So, greetings of the day, everyone. As this Cynodent is organized this revision marathon, I will be taking on cardiovascular system from physiology. Okay, so let's start. Yes. So, let me introduce myself. I'm Kushali Goswami. I've completed my final year on undergraduation from College of Dental Sciences and Hospital Amargat, and I have received gold medal. So the information that you will be getting won't go waste. So these are my contents, that is cardiovascular system function, functional anatomy of heart, properties of the myocardium, cardiac cycle, cardiac output and blood pressure. So what is cardiovascular system? Yes, cardiovascular system is the system of heart and blood vessels that circulate throughout the body. So what are the functions? It will circulate oxygen and remove carbon dioxide. It will provide cell with nutrients. It will remove the waste products of the metabolism to the excretory organs for disposal. See, blood is the only organ that travels throughout our body. Yes. So when blood is traveling throughout our body, it will provide oxygen wherever it is needed. It will take away carbon dioxide. It will also provide nutrients wherever it is needed. It will collect all the waste products from the metabolism, and then it will transport it to the excretory organs. It will also transport hormones to target cells and target organs, and it will also help us regulate the body temperature. So the functional components of the cardiovascular system are the heart, blood vessels, and the blood. So what are the pathways of the circulatory system? There are basically two pathways. First one is the pulmonary circulation, which is a short loop between the heart and lungs, where the oxygenated blood is done, transported. And second is systemic circulation. Systemic circulation carries blood from heart to all other parts of the bodies and then again comes back to the heart. So this is pulmonary circulations. Now see, as you can see over here, in pulmonary circulation, the pulmonary artery is a big artery that comes from the heart. It brings blood from the heart to the lungs, and at the lungs, the blood will pick up this oxygen and it will drop off the carbon dioxide. The blood will then return to the heart through the pulmonary veins. Now see over here. Uh, mm, See, this is the pulmonary trunk and the arteries. The pulmonary trunk and arteries from the heart, it will take to the lungs. Over here, there will be uh, oxygen will be transported to the blood, and all the carbon dioxide will be absorbed back. And from here, the oxygenated blood will again enter through pulmonary vein into the heart. So pulmonary vein is the only vein that carries oxygenated blood, and pulmonary artery is the only artery that carries deoxygenated blood, right? Okay. So next comes the systemic circulation. Now what happens in the systemic circulation is that from the left atrium, the oxygenated blood will enter into the left ventricle. From left ventricle, it will get transported to the aorta, and from aorta, it will go to for systemic circulation. Now, from systemic circulation, it will enter the systemic arterioles, capillaries, and venules in all the organs except lungs. Yes, except lungs, it will travel to each and every organ. Then the veins and then the small veins will convert into systemic veins, and from there it will enter the vena cava. From vena cava it will go to right atrium, from right atrium to right ventricle, and from right ventricle it will go to pulmonary artery. So this is all about systemic circulation, right? So the circulatory system, this is a short diagram which you can draw in your exams, and it is very simple to understand. Now what this diagram shows is, from right ventricle, the blood will go into pulmonary circulation, from where it will receive oxygen, and it will then oxygenated blood will enter the left atrium. Okay. Then from left atrium, the blood will go to left ventricle, from left ventricle to aorta, aorta to all other organs where the oxygen will be supplied to the body. And now the carbon dioxide carrying blood will again enter the right atrium. Okay. So this from left ventricle to right atrium, it is systemic circulation. And from from right ventricle to left atrium, it is pulmonary circulation. So now what is heart? Say if in Viva they ask what is heart, we go blind. But this is the definition that you need to speak it, okay? The heart is a muscular organ about the size of a closed fist that functions as a body's circulatory pump. Functional anatomy of the heart. The heart is located in the center of the thoracic cavity. It sits directly above the muscles of the diaphragm, which separates the thorax from the abdomen and lies beneath the sternum of the two lungs. Okay, so this diagram is difficult to draw, but anyhow, you can just draw a mediastinal line. You can show a second rib. You can show a diaphragm, and then you can show that somewhere here a heart is situated, that is the center of the thoracic cavity. The heart is enclosed and anchored in place by a double-walled fibrous sac referred to as pericardium. The membranes of the pericardium produce small amount of the pericardial fluid that minimizes friction produced by the movements of the heart when it beats. So our heart is covered by a pericardium, and that pericardium contains, between the membranes of pericardium, there is a small layer of the pericardial fluid, and its function is to lubricate so that when heart pumps, that is when heart contracts and beats, it does not produce any friction and easily it can do its movement, right? So what is the characteristics of cardiac muscles? Cardiac muscles are striated, short branched cells. They are uninucleated and intercalated disc. So there are four chambers in the heart, as we know, two atrium and two ventricles, and they all are separated by a septum, due to which the heart can function as a double pump system. See, this is left atrium. This is left ventricle. This is right atrium. This is right ventricle, right? From right ventricle, the blood will go into the, veins, pulmonary veins. Okay. And from left ventricle, the blood will go into the aorta. Okay. So which all valves are present over here? That is this. Between left, it is cusp of atrioventricle valve, that is the bicuspid valve. Okay. And in the right side, it is tricuspid valve. The valve present between the atriole and the ventricle is called as atrioventricle valve. That is, in the left side, it is bicuspid. In the right side, it is tricuspid. Okay. And then over here, we have a semilunar valve, right? Over here, we have a semilunar valve between the pulmonary arteries and the right ventricle. Okay. We also have something called as chordae tendineae and papillary muscles that help in the contraction of these valves. So there are two sets of valves. One is semilunar valves that is present between the ventricle and the vein or the artery, that is the pulmonary vein and the aorta. And then we have a arterioventricular valve. And as we know, this is one-way flow of blood. Okay. So valves. Each of these valves consists of thin flap of flexible but tough fibrous tissue membranes whose movements are passive, that is, they are not active movements. Okay. These arterioventricular valves are found between the atria and the ventricles, as we saw. For the right side, it is the tricuspid. For the left side, it is referred to as mitral or bicuspid. Okay, why it is called as bicuspid? Because it has two cusps. Why tricuspid? Because it has three cusps. Then, and the semilunar valves that separates the ventricles from the associated arteries and veins. Okay, why I am saying arteries and veins? Because for systemic circulation, it is connected with the artery. For pulmonary circulation, it is connected with a vein, right? And the semilunar valves will have three cusps. So the valves of the heart, as we saw, this tricuspid valve, pulmonary valve, mitral valve, and the aortic valve, right? Four valves. The wall of the heart is made up of three layers, right? The epicardium, the endocardium, and the myocardium. Epicardium is the outermost, myocardium is the middle muscular, and endocardium is the innermost. The outermost is the epicardium. It is a thin membrane on the external surface of the heart. The innermost layer, the endocardium consists of a thin, delicate layer of cells lining the chambers of the heart and the wall leaflets. The endocardium is continuous with the endothelium, which lines the blood vessels. The middle layer is the myocardium, which is a thick muscular layer of the heart. It is the thickest layer, although the thickness varies from one chamber to the next chamber, but thickness of the myocardium is directly related to the amount of work that a given chamber must perform when pumping blood. So what are different properties of the myocardium? The different cells within the heart are specialized for their different functional roles. That is, they have atomicity, excitability, conduction, and contraction. What is atomicity? Atomicity means they are specialized pacemaker cells of the heart that are present in the myocardium. It will spontaneously depolarize to the threshold and it will generate the action potential. Where they are located? They are located in the sinoarterial node. Yes, these cells have the highest intrinsic rhythm, making them the pacemakers in the normal heart. So in normal heart, what is the pacemaker? It is a sinoarterial node. What is it? It is a specialized cell which is having the function of atomicity. And where are they located? They are located in the myocardium. Where is myocardium? Myocardium is the middle layer of the heart. Okay. Now next comes the arterioventricular node. It is its cells which is having the second highest intrinsic rhythm. First highest is the sinoarterial node and second highest is the arterioventricular node. Okay. These cells become the pacemaker only when the sinoarterial node are damaged. Okay, understand that? Now Purkinje fibers. They exhibit spontaneous depolarization with a rate of 35 beats per minute. This is atomicity. Atomicity is also called as autorhythmic cells, that is the pacemaker cells. The characteristics of these cells are they have an unstable membrane potential. Okay, that is they can go as low as 60 and they can peak up to 40, forming a pacemaker potential. It is minus 60 and minus 40. Okay, the upward drift will allow the membrane to reach to 40 by itself. When how does it happen? That when there will be a sodium leakage, it will show depolarization. So see, from minus 60 to minus 40, it is called as the pacemaker potential. Okay. So myocardial physiology, that means how these autorhythmic cells function or what are their characteristics. So see, this is a normal contractile myocardial cell. It will have a conduction myofibrils between the intercalated disc, and this is a nucleus. In that, a sinoarterial node cell will be present, or a anterior ventricular node cells must be present. Okay. Now, what are the characteristics? They are smaller than the contractile cells. You see, this is a contractile cell. Yes, this one is a contractile cell. You see this cell, it is so small. They will not contain any myofibrils. They are not organized in a sarcomere structure. See, this is a sarcomere structure, right? These are the myofibrils. All these vertical lines, they are the sarcomere structure, and they will not contribute in the contractile force of the heart. Okay, so for different cell types, this is a rate voltage chart given. This is not so much important. Next comes is excitability. Excitability of the and that is due to the contractile cells. Atomicity was due to the pacemaker cells. Now excitability is due to the contractile cells. So what are these contractile cells? They are special aspects of the intercalatic disc. They are highly voluted, convoluted and interdigitated junctions. It will join the adjacent cells it by either desmosomes or the fascia adherents. And it will allow for syncytial activity, that is with gap junctions. Obviously, they are contractile cells, so they will have more mitochondria than the skeletal muscles. They will have less sarcoplasmic reticulum, they will have larger T tubules, and the myocardial contractions will be graded. Okay. Again, this is the phase of potentials of contractile, where the contraction can go from 1 to 4 within minutes, and again it will shoot up. Okay, so here phase 0, that is a depolarization stage. Okay, so phase 0 is the depolarization stage. It will generally be less than -40. Okay, it will be similar to nerve and skeletal muscles, but it will be mediated by the opening of a voltage gated fast sodium channel. Now phase 1. Phase 1 is the initial repolarization state. What will be phase 2? Phase 2 is a plateau stage. In that plateau stage, there will be depolarization will open, voltage gated calcium channels and voltage gated sodium channels, potassium channels will also open up, right? Phase 3 is repolarization and phase 4 is the resting membrane. Okay, again I'll go to this diagram. This is slow depolarization, right? We saw here phase 0, slow depolarization, slow depolarization. It is low repolarization, right? Initial repolarization. This is initial repolarization. This is plateau stage, a balancing stage, right? This one, plateau stage. This is depolarizing state and this is the resting membrane stage. So maximum potential at 1, resting membrane potential at 4. Myocardial physiology. Myocardial physiology due to the contractile cells. Okay. Skeletal extent potential versus contractile myocardial potential. See, in skeletal muscle, what happens that there will be a refractive period where the muscles will contract, it will reach a peak and then it will slow down. See, this muscle will reach its peak and it will slow down. But what happens in cardiac muscle fibers is the refractive period is longer. Okay, the refractive period is longer. That is, the refractive period will last for almost as long as the entire muscle will twitch back. So this is the difference between normal muscles and between the cardiac muscles. The normal muscles will twitch back within seconds. Yes, a stimulus is given, it will show a peak and it will twitch back. Okay, but this short twitch is required for development of tension in the muscle so that the muscle can contract and it can relax, right? But here the refractive period is less. It is more. In skeletal muscles, the refractive period is very less, whereas in cardiac muscles, it is very big. Okay. So conduction is due to the intrinsic conduction system. So from sinoatrial node through intranodal pathways, the signal will go to the AV node, from AV node to AV bundle, from AV bundle to bundle branches, from bundle branches to Purkinje fibers. Okay. Now contractility. Contractility will be due to the action potential via the pacemaker cells. Done. This is not required. Okay, so this was all about the physiology of heart and how heart functions. Now we will move on to ECG. ECG is electrocardiography, right? So, and it is based on the recordings of the electric potentials that is generated by the heart on different body parts, mostly on the body's surfaces. Electrocardiogram Electrocardiogram is a graphic record of the electrocardiography. Electrocardiography is what we see, and electrocardiogram is what we get on the paper. Okay, it has waves, it has segments, it has intervals. What are the elements of ECG? Waves are parts of ECG which are located above or below the isoline. Segments are parts of ECG which are located in the isoline, and intervals includes the waves and segments. These are waves, right? Segments are parts which are located on the isoline. See, this one, it is a wave. This is an isoline. Now, waves of ECG consist of P wave, QRS complex, T wave, and U wave. As we saw over here, P wave, QRS complex, T wave, and U wave. So, what is P wave? P wave represents the arterial depolarization. When the arterioles will depolarize, it will be indicated by the P wave. QRS complex will represent the ventricular depolarization, and T wave will represent the ventricular repolarization. Okay, this is arterial depolarization, right? Arterial depolarization. See, an easier way to remember this is the first two things, that is the P and QRS complex. It shows the depolarization. P will show of arterial and QRS will show of the ventricles. Now this too shows the repolarization. Okay, T will show of the ventricle and U will show of the Purkinje fibers. So first two will show the depolarization, next two will show the repolarization. See, P wave, arterial depolarization. QRS complex, ventricular depolarization. T wave, ventricular repolarization. Okay, U wave, repolarization of the papillary muscles or the Purkinje fibers. So this was all about the ECG. Now moving on towards the blood vessels. So blood vessels are there are 80 miles of blood vessels present in our body, and they are of three types: arteries, veins, and capillaries. Arteries is the blood that carries oxygenated blood, except the pulmonary artery. It carries the deoxygenated blood. Now veins, blood vessels that carry blood from the body back to the heart, except the pulmonary vein which takes away the blood away from the heart, right? Capillaries. They are tiny tubules that carry blood from arteries to the body cells and then bring them back to the veins. The capillary is a bridging gap between the artery and the vein. The arteries are obviously, they are large, they are thick walled, they are elastic, they carry oxygen. Exception is this pulmonary artery. They carry under great pressure. See, whenever an artery is stepped or whenever an artery bleeds, the blood can put out so fast and so greatly that it can even hit the ceiling of the room in where the patient is being operated, right? So you can understand that with what pressure the blood must be flowing in an artery. And it will be pulsating, steady pulsating. Capillaries, they are small vessels. They can be seen only at microscopic level, and they are one wall or one cell thin. They carry nutrients and diffuse gases. Everything happens over here. Veins, it carries the waste and the carbon dioxide blood, except the pulmonary vein, which we all know. And valves are prevent to Valves are present in veins to prevent the gravity pull. Okay, like see, there are perforators present or the valves present, because what happens that sometimes deep veins are present, right? So this deep vein, sometimes under the gravity, the blood can flow down also. So to prevent that, there are valves present and there are perforators. Perforators means between the superficial and the deep vein, a connection is present. Now blood. Blood is made up of plasma and formed elements. In formed elements, we have erythrocytes, leukocytes, and platelets. Okay, all know this. Red blood cells, that is made up of 99% of blood's cellular component. They are small, disc-like, there is no nucleus present. It cannot reproduce. It will last up to 4 months and then it will rupture. It is produced by red bone marrow and it contains hemoglobin and it carries oxygen. Hemoglobin, we all know about this. It is a complex protein made up of 4 protein strands plus an iron-rich heme group, which contains 4 oxygen atoms in each. These heme groups. The presence of oxygen in turns the hemoglobin to bright red color. White blood cells, their nucleus is present in it. They are of 2 types: granulocytes, agranulocytes, and they can be called as basophils, eosinophils, lymphocytes, monophils. Okay, they are active in immune system. They help to fight disease and infection. Platelets, again, platelets are the cell fragments that are used in blood clotting. They are derived from the egakaryocytes and they help form a clot at the site of wound, and this clot will prevent the excessive blood loss. We all know the intrinsic and extrinsic pathway through which a cascade is formed and the platelet will form a mesh-like structure so that the bleeding will be stopped. Next comes is the cardiac cycle, right? Cardiac cycle was developed by in the 21st century by president Carl G. Wingers. He developed the modern criteria of phase analysis of cardiac cycle, right? He studied the cardiac cycle and developed the phases in which it acts. So the cardiac cycle, there are 2 basic phases, the systolic phase and the diastolic phase. The systolic phase, it means that the heart muscles are contracting. Diastolic phase is the phase where the heart muscles are relaxing. So cardiac cycle refers to all the events that are associated with blood flow through the heart. Okay, so cardiac cycle, systolic phase and diastolic phase. Within 4 seconds, the systolic phase is completed, and in 9 seconds, the diastolic phase is completed. So this entire phasic representation was given by Sir Carl J. Wiggers. The cardiac cycle, which lasts for 0.8 seconds, it has a ventricular systole and a ventricular diastole, and total there are 9 phases. Okay. Period of isovolumic contraction, period of ejection, period of isovolumic relaxation, and period of filling. Let us study all of this in detail. This is a very good diagram which you can draw in your papers, right? It shows the ventricular systole and the ventricular diastole very easily, and all the 9 phases are represented over here, right? All the 9 phases. So phase 1, asynchronous contraction. It is the beginning of this phase and the end of the presystole. That is end of the diastole. It is this phase marks the beginning of when this phase will end, the second phase will start. Okay. So in the beginning, the anterioventricular valves are open, and in the end, they will be closed. The semilunar valves will remain closed over here because it is a contraction. During this phase, the ventricles will contract, the ventricular cavity volume will not change, and the ventricular cavity pressure will also not change. The ventricles will just contract. In isovolumic phase, what happens is, in isovolumic phase, there will be ventricular contraction. the cavity volume will not change, but the cavity pressure will increase. Now, what happened in the phase 1 was the AV valves were open in the beginning and the AV valves were closed in the ending. What will happen in phase 2 is the semilunar valves will remain closed in the beginning, but the semilunar valve will open up in the ending. Why? Because the ventricular cavity pressure has increased. Next is rapid ejection phase. What will happen in rapid ejection phase is the semilunar valves will be open. Since in phase 2 they were open, so still they are open. Okay, and during this phase the ventricular cavity volume will decrease. The pressure increased in phase 2, so now the volume will decrease in phase 3. Okay, in phase 4, that is the reduced rejection phase, what will happen is one third of the stroke volume will be slowly ejected and the ventricular cavity volume will decrease. See, it is same. AV valves are closed, SLL valves are open, same as phase 3. In phase 5, what will happen is the beginning of the phase 5, the valves will remain open, but now they will close. At the end of phase 5, they will close. So in phase 6, they should be closed. Here, ventricles are not filling, ventricles are now relaxing. The relaxation has started. The cavity volume will also not change, the pressure will also not change. Now, AV valves will open. At the end of the sixth phase, that is the isovolumic relaxation phase, the AV valves will open. Why they will open? Because the pressure inside the ventricles will increase. Okay. Now that the pressure is increased, the ventricular cavity volume will also increase because the pressure inside the ventricles will slightly increase more. The ventricles will undergo a rapid filling state. So the valves will remain open throughout the rapid filling state, right? Now, in reduced filling state, what will happen is the ventricles will be ventricles are slow filling, and the ventricular cavity volume will also increase. So, in phase 9, that is the pre-systole phase, the AV valves will open up, the semilunar valves are closed as it is, and during this, the ventricles are rapid filling, the ventricular cavity volume will also increase, and the pressure inside the ventricles will also slightly increase. What will happen over here is that during the ventricular relaxation, blood will flow from the arteria to the ventricles. When both the arteria will contract almost simultaneously, it will pump the remaining 25% of the blood into respective ventricles. Okay. So this is the pressure per mg, right? Intracardiac pressure, how much the right ventricle will pressure, how much the pulmonary artery will pressure. That is all what is given over here. Cardiac cycle, the blood volume and the pressure. Yes, this is same for one cardiac cycle. Yes. At 10 diastolic volume, it should be around 120. Then the pressure will decrease to 135. Then it will again decrease to not 135 but 80. While coming to diastolic, this is systolic, this is diastolic, and this is the stroke volume. So cardiac output, it is the volume that is pumped by the left ventricle in each minute. Okay, it is known as the cardiac output, how much the heart can pump for the systemic circulation. It is influenced by the stroke volume and the heart rate. So the cardiac output is directly related to the heart rate and the stroke volume. Now, blood vessel structure. The structure of blood vessels enables them for specific functions. Okay, the artery is, you can see, larger in diameter up to 4 mm. Arteriole, you can see it is 30 micrometers. So it is very small. Okay. Since aorta is bigger, it absorbs the pulse pressure, it will release energy, thus it will create a diastolic pulse pressure also. Blood vessel structures in that capillary venule veins, you can see as the vein is larger up to 5, but capillary 8.5, very small, right? Physical characteristics of the circulation, hemodynamics. Hemodynamics is the description of the law which governs the blood flow within the vasculature. Ultimately, all blood will flow between 2 points within the vasculature, and it is actuated by differences in the pressure of blood between these 2 points. Now, interrelationship among the pressure flow and the resistance. So blood will flow through a vessel which is determined by two factors, that is the pressure gradient and the vasculature resistance. See, this is the pressure gradient, that is from one point to the entry point to the exit point, how much pressure change can occur within two ends of a vessel. And vasculature resistance is throughout the flow, vessel is impeding how much resistance. See, if it will be a vein, it will be having 3 to 4 walls, so it can exert more resistance. Whereas a capillary is a thin one wall, so it cannot apply any pressure, right? The flow of through which the vessel, it can be calculated by Ohm's law. It is P minus P, P1 minus P2, which is the pressure difference between 2 points divided by the resistance. So systolic pressure, the pressure that is created when the ventricles contract. So when the ventricles contract, the pressure that is created in the artery, it is around 120 mmHg. Blood pressure, the diastolic pressure, the pressure that is created by the recoil of the aorta and the closure of the semilunar valve, which is around 80 mmHg. Blood pressure, pulse pressure. Pulse pressure is systolic minus diastolic, usually the difference. It will apply only to the artery, right? And mean arterial pressure is diastolic pressure plus 1/3 pulse pressure. Okay, so that was all about the cardiovascular system. I have this Instagram ID called as Dental Zone, where you can always reach out if you have any doubts. So thank you.